Hey everyone, welcome on this Wednesday night to AP Gov podcast with Evening. So tonight's stream is on Social Security policy, healthcare policy, and education policy. Whether or not you've gotten to this in your AP Gov class doesn't really matter. Because we are going to be getting the whole introduction to these and looking at some of the policy problems with them. I can guarantee you that you will see all three of these on the AP exam. And they're often issues that are policy areas that students struggle with. And so as we go through them tonight, if you have questions, please just stop me at any point, and I'll be more than happy to answer those for you. So first, tonight we're going to look at Social Security, Medicare and Medicaid, Obamacare, and some of the big education policies that you need to understand. So let's jump into Social Security, okay? So Social Security comes about in the 1930s during FDR's New Deal, okay? Now, if you don't know anything about the New Deal yet, even though this isn't a U.S. history class, you really need to take some time, and we'll actually end up doing a cast here pretty soon on this, probably next month. To understand the New Deal and the Great Society programs. Because, and I actually, with my own students, I took a day each for those programs because, again, while it's not a U.S. history class, we talk about these programs frequently in AP Gov because of the policies that came out of them. So the New Deal was basically FDR, or Franklin Delano Roosevelt, president in the 1930s, plan to get the United States out of the Great Depression and get people back to work, fix the problems with the banking system that had basically gotten us into the Great Depression in the first place. And one of those programs that he wanted to put into place, and he does sign into law in 1935, is Social Security. Basically, it's a federal safety net. And so sometimes you'll hear about social safety nets. This is an example of a social safety net. And basically, the concern here was that there were a lot of elderly out there who were out of work, okay, maybe who were not physically able to work anymore, but didn't have any income coming in or very little income and were basically starving to death. And so the Social Security Act created an insurance program that required anybody that's employed in the United States to pay a small contribution via a payroll tax, okay, into an insurance fund designed to assist the unemployed and help financially strapped retirees, okay? And so the main part of the Social Security program allows you to take out Social Security when you are 65 years of age, okay? Social Security is not meant to be a full retirement check, okay? You should still save on your own. You should hopefully have a job that has a retirement benefits with it. Social Security is meant to be a little bit of extra money to help you. Now, the Social Security check that I get when I'm that age, which is a long time from now, or that you get when you're that age, may be very different, okay? Because it's all based on how much you put in, okay? So I'm just going to give you a really simple example. Let's say that you own, or excuse me, not even you own. Let's say that you work at a restaurant as a waitress for your entire life, okay? Well, you're going to pay into Social Security, okay? That's automatic. But what's not going to happen is the amount of money that you're going to get out of Social Security when you're 65 compared to what I'm going to get out of Social Security is going to be very different. Why? Because you're not going to put as much in as I do as a teacher who has a much higher salary than someone who's just working as a waitress or a waiter at a restaurant. Now, here's the other thing that a lot of people get confused about with Social Security. When the government takes that money out of your paycheck, okay, it does not go to a little account at the federal government that has your name on it and has all the money that, in my case, Robbie May has ever contributed to Social Security ever since I started a job when I was 16 years old working at Dairy Queen, okay? Nope. All of our money goes into one big pot. So the money that I've contributed, the money that my sisters contributed, my mom and my dad, my grandparents, you if you have a job, all that money goes into one big pot, okay? And the money that I get back is not going to directly equate what I put into that system, okay? So don't get that confused. And I'm going to come back to that here in just a couple minutes. So the other thing is that 65 was quite old when the Social Security Act was put into place, okay? Most people, if they lived to 65, didn't live a whole lot longer after that. That's not the case today. So people get Social Security checks for much longer than what they used to today. Now, the Social Security Act did two other things that's important to mention. It added an additional assistance program to help the blind, the elderly, and less fortunate people. Basically, people that are unable to, well, I'll give you a good example. So my school has a special education population for people that have severe and profound disabilities. So people who are classified as severely developmentally disabled, okay, or not really able to function in a normal classroom or will require lots of assistance and help throughout their life. They'll never be able to be independent. This is that their parents would get a Social Security check every month from the government to help offset some of the costs that come to caring for them. So that's a second thing Social Security did. A third thing that Social Security did was that it guarantees all who pay into the system would collect retirement benefits at the beginning of age 65, okay? And so those are the big things that Social Security does, okay? I don't know why I said that. Yeah, so it also will assist the unemployed. I said the same thing that I said the first time. I'm sorry, I'm getting tired at this time of night. So just so people are clear, number one, it sets up the retirement program at 65. Two, the checks for the people that have handicaps, severe disabilities. And three, an uninsurance program. An insurance program for unemployed. Woo, if I can speak tonight, okay? The Social Security Administration handles these funds. And so from birth, you get a Social Security number. That is basically your Social Security account number, per se, for the entirety of your life. But we just use it for lots of other things as well, too. So here's the problem, okay? We're all putting money into this one big pot, okay, for Social Security, which doesn't sound like a bad thing on paper. But let's take a look at the budget here, okay? So what this shows you is mandatory versus discretionary spending, okay? Now, I'm going to explain this, and actually tomorrow night, this is going to be the whole presentation that I'll be streaming on, okay? This, let me see here, where am I at? These two blocks right here that are in blue, okay, are the two discretionary spending areas of our budget. So it's less than 50%, okay? Just about 40% of our federal budget every year is discretionary, meaning that the federal government can decide how they want to spend that money, okay? So when we take it apart, 50% of that discretionary spending goes to defense every year, okay? And then we can break it down into lots of other categories, education and transportation and all that. That's the money that they can decide how much they want to spend and what they want to spend it on. It's at their discretion. All this in red is mandatory spending. Okay, it means that by law, the federal government has to spend money on these things every year. And you can see that mandatory spending makes up well over 50%, almost 60% of the budget. And if we look at that, the biggest chunk of that pie is Social Security. Because the Social Security Act guarantees people over the age of 65 can get a Social Security check if they've paid into the system, the government has to pay that every year. The government has to pay Medicare and Medicaid every year. And then there's all these other little mandatory things that they also have to pay. But healthcare and Social Security are the big ones, okay? The government has to pay out every year. Now, just a second ago, I want to clarify something that I said. I said that you got Social Security checks if you paid into the system. Well, not everybody pays into the system. Well, if you never worked in your life, like, for example, maybe this is especially true with maybe your grandparents' generation, but maybe you have a grandparent who was a grandmother who was a homemaker. She stayed at home and raised the kids. She would not get a Social Security check because she never worked. If you worked in some type of job where you were paid under the table and that's all you ever did your whole life, which is kind of illegal, but that's a different story, you would not get a Social Security check because you never paid into that system. So the idea here is that Social Security is an incredibly expensive program. Now, you might also hear that there's a problem with Social Security. I don't plan on getting Social Security right now. I mean, you really shouldn't either. Not by the time that I'm ready to retire and the time certainly that you are ready to retire. Because the Social Security fund is drying up, okay? Remember when I said a couple minutes ago, everybody's Social Security money goes into one big pot, okay? And so when I say one big pot, here's the problem. There's not enough of us, meaning young people that are working, paying into that pot compared to the number of older people over 65 who are taking out of that pot. So this is a little infographic that I found that I think is really helpful in understanding this. So in 1950, there were 16 workers for every one person that was pulling money out of that Social Security pot, okay, that was 65 years of age or older. In 1960, that number was 5 workers to every one person taking money out. In 2015, it was 3 workers for every one person taking it out. By 2035, that will be down to 2 workers for every one person that's taking money out. Now, why is this happening? I'm going to actually throw that to you. Why do you think the amount of workers putting money in is going down compared to the number of people that are pulling money out? Yep, baby boomers, you're exactly right. You're exactly right. So when we look at a population graph of the United States, there are way more older people in the United States right now than there are younger people. Because right after World War II, okay, we had a massive baby boom in the United States. And so all of those people are now getting to retirement age and are starting to collect Social Security benefits. Well, we're not producing the same amount of children that we did in the 1940s and the 1950s when the baby boomers were being born. So because, number one, we have a large aging population, and number two, people live much longer today, okay? Those two are big problems for Social Security. On average, the average life expectancy now in the United States is like 77, 78 years old. So that means that people are almost collecting Social Security for almost 15 years, okay? Which was never what FDR had envisioned it to be, okay? Because like I said, back in the 1930s when the plan was put together, 65 was pretty old. So now the problem is if we don't do something to fix Social Security, well, you can see there by 2035, there's not going to be enough people paying in to pay it out. And so what's going to happen is Social Security is going to go bankrupt, okay? They're not going to have the money to pay me and to pay you, even though we've paid in. Like, this is why I go back to the thing and say, you and I do not have a little specific box in the federal government in Washington, D.C. that has our names on it, that has our money in it, okay? It's going into a big pot. And my money's going out just about as soon as it gets there. And so if they don't do something to fix it, well, the likelihood that you and I will see Social Security is really, really small. Now, so what do you do to fix it? Well, really what needs to happen is we have to raise the retirement age from 65 to a higher number. Our politicians in Congress on both sides know that. Many people campaign on fixing Social Security, but no one is willing to do it, okay? Now, why isn't anyone willing to do it? Well, this gets into voting behavior, okay? Because if you haven't done voting behavior yet, one of the things that you'll learn in this class when you study voting characteristics and the way that people vote is that old people show up to the polls, okay? They are the people that are of basically 50 years of age and older are the most likely people to show up at the polling booths on election day. So if you're a politician, you know this, okay? Young people don't come out to vote. And if the people that gave you your job in Congress are generally over the age of 50 years old, You know darn well if you vote for a Social Security bill that's going to raise the age from 65 to, let's say, 70, well, you're probably not going to have a job for much longer. So it's a very unpopular decision, even though that's basically the only way that we're going to fix Social Security. So that's a consideration for what needs to happen. Now, will we ever see it happen? I don't know. If we want Social Security to last, that's what's going to have to happen. But that's a problem for another day. So this is a great little political cartoon, and I like to share political cartoons here because you get them on your AP test, okay? And so what do you think is actually being said here in this political cartoon? What's the meaning behind what this artist is trying to communicate? I'll give you a second here to share your thoughts. What do you think the artist is trying to communicate? Yeah, you're exactly right. So here we've got a bunch of kids, okay, that are holding up Social Security, but just barely, okay? And this is part of that, well, there's not enough of them to hold up what needs to happen. Social Security is starting to get these cracks in it, okay? Because there's not enough of us, okay? And you've got the older people over here who are saying, we don't care how, just keep supporting it, okay? So maybe the other thing that could be an option is if we don't want to raise the age. I'm sorry, my dog is crying in the background. She wants attention and she's not getting it from me right now. The other thing is that we could increase the amount that we take out of people's paychecks, okay, for Social Security. I guess that depends on your ideology when it comes to taxes and everything like that. If we don't want to raise the age, then, I guess that would be another option to look into. Okay, so then let's go on to Medicare. So Medicare is a program of the Great Society, which was Lyndon Baines Johnson, or LBJ's program, or group of legislative programs in the 1960s, okay? FDR, Truman, Kennedy, all Democratic presidents had all tried to expand the social safety net from just Social Security to also providing health care, but they were unable to do so. It would not be until LBJ in the 1960s that we get a government health care program, which we call Medicare, okay? And similar to Social Security, okay, it's for persons over the age of 65 years of age, and it helps to ease their costs, okay? So it's not your sole health insurance, just like Social Security is not your sole retirement, but it's going to help offset some of those expenses that you have, okay? So once you reach 65, you're eligible to go on to Medicare, okay? And most people over 65 have Medicare, as well as their insurance, which they have from whether they buy it privately or whether they have it left from the company that they worked for, et cetera, the organization they worked for, because healthcare is incredibly expensive, okay? Very, very, very expensive. You can't privately pay for your own healthcare unless you are very, very, very wealthy, okay? Medicare is administered by the Department of Health and Human Services, and it's funded by, just like Social Security, a payroll tax of 1.45% paid by both the employer and the employee. So same thing, you and I are paying into a giant pot that is for Medicare that pays out money to people over 65. The law is broken into 4 parts to cover hospitalization, physician services, public-private partnership known as Medicare Advantages that allow a company to provide Medicare benefits, and a prescription drug plan. Medicare can cover up to 80% of your healthcare costs. So this is why it's important to have another insurance plan to help pick up your own personal insurance plan to help pick up the other 20%. Because like I said, it can be really, really, really expensive. So you typically, when you hear Medicare, you hear it in parts A, B, C, and D, okay? Part A is what provides your insurance if you go to the hospital. Part B is medical insurance, okay? So like if you are, you're going to like an urgent care center because you've got a cold and you need some medicine, your doctor. Part C is the Medicare Advantage plans. And then Part D, which is just added in the early 2000s, are prescription drug plans, okay? Now, You know about Social Security, so you have a little bit of idea here. We're having the same problem with Medicare that we're having with Social Security. Okay, too many older people who are 65 or older, or who are approaching 65, who are taking this out, and not enough of us younger people who are paying into the system. Now, on top of that, healthcare costs are continuing to skyrocket. Okay, the cost of hospitalization, the cost of medicine, all of that is very, very, very expensive. I'll give you an example. I'm actually a paramedic as well too. I'm a teacher and a paramedic. So maybe you have an EpiPen. Okay, that EpiPen costs your parents about $500. Okay, for something that is life saving, that will save your life if you ever have a severe allergic reaction. Okay, well, friends, here's a little fun fact for you. The actual vial of epinephrine that's in your EpiPen only costs $5. Okay, that's it. It only costs $5, but yet they're charging you for the EpiPen $500. Healthcare costs are out of this world. Okay, and so the cost that people end up having, the government ends up having to pay for people who are over 65 grows every year. On top of that, you've got more and more people who are over 65 every year, and you've got less and less of us young people paying into that. Okay, so same problem as Social Security here is that you've got to figure out a way to fix this. Okay, whether it's more money. Plus, you have to think about it. Older people have more health problems than younger people. And then just like with any health insurance program, you have the vast majority of people, 90% of the people that pay into a health insurance program hardly ever have to use it, or only use it for minor things. Like, for example, for me, okay, I take one medicine and I go see the doctor once a year for an annual physical. And maybe if I have like a really bad cold or something, I might go. But I'm not having any major surgeries or any major health conditions that need constant treatment. But then you have the 10% of the population that does have some pretty severe medical issues, whether it's something like cancer, whether it's a long-term issue like heart disease or kidney disease or something like that. And when they have to get treatments all the time, those things are very, very, very expensive. And so you need lots of healthy people to be paying into an insurance program. So Medicare has similar problems as Social Security. So one of the arguments about the age pieces, raising the age for Social Security, for Medicare, whatever, is a lot of people plan their retirement based on when they can get Social Security and when they can get Medicare, because they cannot afford to retire until they have those two benefits coming in from the government. And so they will wait until 65 and then retire. Well, if we raise it, now you're telling people, oh, sorry, you're gonna have to work until you're 70 instead now. Well, people aren't gonna want to hear that, and so that's one of the concerns too. Okay, now the other end of that program is Medicaid, and this also comes about as a part of the Great Society of LBJ in the 1960s. Okay, so Medicaid provides health insurance coverage to the poorest Americans. Okay. To be eligible for Medicaid, citizens must meet minimum income thresholds or be disabled or pregnant. Okay. Now, Medicaid will cover every child in the United States. Okay. Every child in the United States up until their now 18th birthday for Medicaid can be covered by health insurance. Okay, if your parents do not make enough money to purchase health insurance because it's expensive and maybe their job doesn't provide it, okay, you can have Medicaid, okay, insurance. Okay, same thing. If you're born with a disability, you automatically can get Medicaid insurance. Okay. But generally, Medicaid is for people who are below a certain income level, okay? And you can do a quick Google. It changes, okay? But a quick Google search would tell you like what the current income level is. It's pretty low, okay? And the way that this is administered is it's administered via block grants to the states. So probably you've done federalism at this point. And so what the federal government does is it gives large block grants of money to the states for Medicaid. And each state has its own Medicaid program. So like in Maryland, it's not called Medicaid, it's called Maryland Physicians Care. They're called different things in different states. But Medicaid is a program that's there. Okay, and it's again specifically for people who otherwise wouldn't be able to afford health insurance. But basically, you have to meet a really, really, really low income level. So there are still a lot of people out there that don't have health insurance because they can't afford it and they're not eligible. They make too much money to be eligible for Medicaid. So the other big healthcare program then became the Affordable Care Act, or what many people just know as Obamacare. Okay, and it was the major health legislation and one of the major pieces of legislation under President Obama that was signed in 2009. So it then expanded Medicaid to cover more individuals. So it now covers more individuals than it once did, basically because they rose the income requirements, or lowered. No. They rose them up. Okay. It creates markets where people can shop for the most affordable healthcare option via a website online. You can put in your information, how much money you make, and all that, and then there'll be all sorts of different plans that will come up. Sometimes which include Medicare or Medicaid, excuse me. So I'll give you a personal example. It's been 5 years ago now. My first 5 years in teaching, I spent teaching in North Carolina. And then after 5 years teaching in North Carolina, I decided to move back to Maryland where I grew up. And it was about a year between my job in North Carolina and between when I got hired at the school that I teach at now in Maryland. Where I didn't have a teaching job. And so thus I didn't have any benefits, including health care. So I went on the Obamacare website, okay, and shopped for health insurance to find my health insurance plan. And because at that point I was just doing some substitute teaching, my salary was low enough that I actually qualified for Medicaid. I ended up choosing a different insurance program because there was another one that I saw on there that I thought would provide a little bit better benefits, even though I had to pay a little more than I would for Medicaid because Medicaid's free. I felt was better for me, and that's what I ended up doing. Okay. The big piece of Obamacare is what's called the individual mandate. Okay, and it basically mandates that all persons buy health insurance, or you have to pay a penalty. Okay, at tax time, and that penalty was about $500. Okay. Most people that didn't have health insurance said, well, I'll just pay the penalty, okay, because the penalty is way less than what the cost of paying insurance every month is. So in terms of trying to force people to buy health insurance, it really didn't work that well. Certainly more people signed up for insurance as a result of Obamacare, but in terms of like trying to deter people from not having insurance by putting this penalty, it doesn't really work. And I'll give you a perfect example. By the time that I had got my teaching job, my health insurance cost was almost $400 a month. Okay, $400 a month for a guy. At that point, I didn't take any medicine. Healthy. I'm overweight, but otherwise, I'm healthy. $400 a month is how much I'm paying, and that was a lot of money when my only job really was substitute teaching. So it makes sense. A lot of people. I mean, I have friends that have jobs but can't afford to pay for the health insurance every month, and so they just paid the penalty once a year, which was $500. It's a lot cheaper than paying, in my case, $500 a month. Now, the individual mandate was eliminated by the Republicans after the 2016 election, and they got rid of that requirement. Now, they have tried to repeal and replace, as the big words, Obamacare multiple times now, but they've been unsuccessful in doing that. Under President Trump and the Republican control, even when they controlled both the House and the Senate prior to this most recent midterm election, they've been unsuccessful in actually repealing and replacing the Affordable Care Act. So it still stands. However, they've got certain pieces of it, including the individual mandate. Okay, so that's healthcare policy. Okay, there are a couple differences here between Republicans and Democrats on healthcare that I just wanted to highlight. Democrats really believe that it's the government's responsibility to ensure that health care is provided to everyone, and because they feel it's a human right. the Republican Party, it's not that they disagree that everyone shouldn't have health care, but they don't think that the government should be involved in what typically would be a private business. They think that they should turn over control of healthcare to private businesses. That's why we call it privatization, to companies to run it who that's their business and who know how to do it. They say that the government shouldn't be involved in that type of thing. Okay. Those are the big examples. Many Democrats, and you're seeing this now with the Democratic primaries, would like to see universal health care, where we provide health insurance to everyone in the United States. And the cost really is the higher taxes. But almost every industrialized country in the world provides universal health care. We're one of the very few that does not. Okay, now let's talk about education policy. So education policy and the government's role in education really begins back in the 1960s, again, with LBJ and the Great Society. LBJ really had a heart for education. Why? Because he was a teacher. He grew up poor in Texas. He became a teacher, and he taught poor children on the immigrant children on the Mexican United States border. And so he was incredibly concerned that there were some schools that had a lot of money and other schools that didn't have any money, especially in poor rural areas like where he grew up. And so as a part of his Great Society / War on Poverty program, he really focused on education. And the landmark education bill that was passed was the Elementary and Secondary Education Act, or you hear it called ESEA. Basically, it was the federal government giving money now to lesser funded schools, okay, so that they could have adequate resources. State officials welcomed the law because of the federal government's handoff approach to school management and broad discretion that it gave to local authorities on how to spend the money. It was kind of like a block grant in some ways. Basically, they said this money needs to be spent in the schools that meet, this income level, that have this type of, they're in rural areas, whatever. Okay. But how you want to spend it, what you want to use it on to improve your school is up to you. Okay. Which is why the states accepted it, because you might be thinking, going back to federalism, well, isn't this a violation of the 10th Amendment, the Reserve Powers Clause, because there's nothing in the Constitution about education? Well, you're kind of right. Okay, education really shouldn't be a federal issue. It is now, and it really started with the Elementary and Secondary Education Act. Okay, because the state said, "Oh yeah, we'll take your money," because we know states love those grants, grant money, because that's money that they don't have, and the federal government's giving it out. But a lot of times there are strings attached to that. That's all going back to federalism, though. And then in 2002, the Elementary and Secondary Education Act was reauthorized and renamed No Child Left Behind, or NCLB. And basically, the law declared that every child can learn and that the schools and the state should be held accountable for student learning. Okay? It called for highly qualified teachers in the core subjects in every classroom. Okay? That used proven teaching methods, and it's had threatened sanctions if schools were underperforming. So what's a highly qualified teacher? Well, that's just a teacher that has a college degree in the area that they teach and / or have passed a teaching test to prove that they are knowledgeable and highly qualified in the area they teach. So I had to pass, it's called the Praxis test in social studies before I could ever get my social studies certification to prove that I was highly qualified, and also have my degree in social studies education. And then the second piece here, the sanctions. If schools didn't meet, having your staff highly qualified, if they didn't meet the testing things that it put into place here, the schools could be sanctioned. Okay, and actually, if it was so bad that after years and years and years of sanctions, the federal government could come in and take over the school. When I was teaching in North Carolina, there was a school district in a county next door to me that had one whole high school in the district completely taken over by the federal government. They came in, fired the principal, fired all the teachers, and started all over again because their test scores got worse and worse every year. So with the requirements and rewards came greater emphasis on testing in the cloud of federal intervention. Okay, basically NCLB required that students show adequate yearly progress, or AYP, through federally required tests. You have to be tested in elementary school. every year in reading and mathematics. In middle school, I don't remember what the requirement is. It's been a long time since I taught middle school. And in high school, you have to be you have to be tested once in both of those. And then it also had some requirements like for science and things like that. You had to be tested at certain grade levels for science. So all the tests that you take now, and it depends where you're at and what state, what they're called, you can thank No Child Left Behind for that, because that's why you have that, because it's basically a data tool for the government to look at how successful the schools are doing and if they should still get that money or not get that money. And then in 2015, President Obama again reauthorizes the act, and this time it's renamed to the Every Student Succeeds Act. Under this law, the challenging goals of NCLB were eliminated. Not testing altogether was not, but some of the specific goals that every child in the United States would be able to read by X grade were eliminated, okay? And states are free to determine their own standards for educational achievement while still upholding protections for disadvantaged students. It also offered incentives to states to adopt new national standards, what you guys know as Common Core, or develop their own that required students to be college and career ready at graduation. The federal Department of Education must still approve each state's plan in terms of how they're going to make sure their students are college and career ready and meet the requirements of the law. And so that's the big things in education policy. Okay, well, I hope this was helpful. It will be archived on Fiveable, so you'll be able to go back and you'll be able to look at it at any time, especially once you get to it in class, because I guarantee you're going to see it again. Okay? Have a great night. Thanks for joining me.